Good evening, guys. Shall we start? So, first of all, I'm Dr. Faisal Qasim. Uh, I'm the one who founded the AMC Catalyst, and we plan to host a session for all of you. So, I invited Dr. Deepthi Madhuri. She's a GP in Australia, right now working in Australia. Welcome, ma'am.
Thank you, Faisal.
And we have Dr. Aditya. He's also cleared AMC 1. We have Dr. Anne Maria George. She's a IMG. She is also cleared AMC 1. And we have Dr. Dhruv. He was one of our community members from the beginning. And we have Dr. Pooja Ranjit. She's also cleared AMC 1 and she's also our community member. And this session is basically for you guys to clear your doubts. Okay, first I'll give a brief introduction what is AMC Catalyst, and we are planning to give out free guide like from the beginning to the end how to write AMC exam and what pros and cons, what all things you have to look. All the stuffs we will give out a guide after the webinar. Right now we have this much people who already cleared AMC one, and we have Dr. Deepthi already working in Australia. And you should follow her Instagram page also. She is providing all the information in her page. And second thing is that we will give each of our guests time to answer your questions. Okay, all the questions will be answered. Wait, let us start, and we'll give time for you to ask questions. Okay, now so this is the book which we are going to guide, which is free, and this is a guide which we are going to launch today, and this is free for everyone, and it will be shared in all the groups so that it will be easy for you guys to understand, and you don't have to ask so many doubts. So it will be easy for us to explain, and this is the overview of what AMC and what AMC Catalyst is. And we will have this much thing in our guide. Like we'll have an introduction, we'll have a talk about epic verification, AMC portfolio creation, AMC1 exam, AMC1 booking, in what English tests you have to do and how much score, pathways after AMC1, jobs and salaries, total cost of summary, timeline to reach this step, guide how to use guidelines. We will explain that also, and books to refer. So this much is the 12 chapter I have included, and we have included other some motivation and some stuff also in the guide. Rest everything we will talk with our chief guest like Dr. Deepthi ma'am, and other members who already joined. And i- at the end we will have around 10 minutes section for asking your clearing your doubts. So basically we have taken many sessions like many webinars about what is AMC and what all stuff we have to know about AMC. We already know that stuff. So today we already have some questions from our members to the guests. Like they already asked 2 3 questions in the group, asked me to ask you. So we will be asking that also. And first of all, let's welcome Dr. Deepthi Madhuri ma'am, and she will share her experience, like and why she chose this pathway, and we'll begin the section like that. Okay, is it okay, ma'am?
Yeah, sure. You want me to start right now?
Yeah, yeah, that'll be better.
Can you hear me?
Yeah, yeah.
Sorry, my lighting
I'll
is not
just
good.
can you hear me, ma'am?
Yes, I can.
Yeah. Right.
Do you want me to start?
Yeah, you can start, ma'am.
Hi, dear doctors. Hello, everyone. A warm good evening. I think so. I'm expecting there in India. So, okay, from where should I start? Why I choose GP? Why I choose Australia? I'll be very quick in this. I don't know why, but it just came in my mind even before I've started my medicine. On the day one of my medical school, I've decided that if I do want to, I mean, if I want to do something in my life, that is Australia. I don't know, that just came into the mind. So I have prepared all my medical school, all my life just for Australia. My exact preparation have started after internship itself. I have sat. Unfortunately, my epic verification took very, very long, almost 4.5 months, and I missed an AMC date also because of that. Unfortunately, first suggestion: please clear your epic verification as soon as possible. It can be a stone in your process if it is delayed. Second, I have cleared my AMC somewhere in June or July 2023, and then I have started to apply for jobs. Even though my uncle is a pharmacist here in Australia, it doesn't work. Even anyone living in Australia, it doesn't match up, doesn't help for any jobs, frankly speaking. It's only your CV, maybe until unless your people who ever living in Australia know very big contacts or you have strong communications, it doesn't matter. So we all tried. I tried for jobs a lot. It almost took me 6 months, but the confusion was I wanted to be a general practitioner. Everyone says that you can't be a general practitioner without 3 years of experience. I was like, what? Why is this like that? I just dig in more APRA rules, everything. I checked. Then later I got to know that it is wrong. There are two categories. One is called area of need, other is called supervision. So under limited area of supervision, more doctors can be recruited. But this is very hard because you need some supervision, you need some doctors checking on you, everything. So it's not easy for you to get job under this. So everyone says 3 years. I took screenshots attached in the email saying that I'm looking for this position which does not require 3 years. Then maybe I found some Australian articles everywhere. I then read it is called non-VRGP. Then I have started applying for that jobs. Luckily, I was not interested in the hospital, but I have applied multiple jobs in the hospital just to make sure I won't miss any opportunity. Frankly speaking, I might have applied around 150 jobs at that time and got one reply and they gave me the job. So don't get discouraged if you don't get anything. You just need to hit that right one employer who can give you the job. You don't need replies, you don't need interviews from all of them. It's only that one right person until which you need to search, dig and dig. Jobs are very, very hard, even if you live in Australia, even if you live out of Australia. I've seen a lot of people who have even permanent residency through their partners, but still unable to get the job. So it is not any discrimination. It is like that because they don't want to risk anything. They go according to the process, they think a lot to give job to someone. It's not only in medicine, it's like that in every profession. So jobs are hard, you need to work hard. So I got the job almost around in 6 months, luckily in the general practice. I love prevention, I love general practice, I love contacts or communication with the patients, regularly contacting um, with the patient. So, and here I am after almost nearing to 2 years of my work in Australia. I'm working as a general practitioner and raising awareness. The major reason I'm raising awareness for this is because everyone thinks general practice is some drawback or for a loser thing. I've heard it. Practically, I've heard these terms. That's why I'm sharing it. Just because if you don't get a job, then you go for the general practice. No, general practice here involves a lot of responsibility, a lot of work, amazing work. There will be some clutter, there will be a lot of paperwork, which is the drawback of general practice, but still it is an amazing. You maintain contacts, you maintain connections, you have regular patients, you check on them all the time, their health and everything. So I wanted to raise awareness that general practitioner is such a big role that you play, and you need to have knowledge on every topic because you're the first point of contact and patient can come and ask anything from top to the toe, which you should be aware of, or at least you should be aware of sending to the appropriate specialist. So it's not that easy. A pulmonologist can say that, sorry, this is out of my scope, but a general practitioner cannot say that this is out of my scope. So general practice needs knowledge very broadly, and at least they should know everything basically. At least they should know where to refer them, where to get the good help, because they are your regular patients. The very next day patient come and say, I did not find anyone, please give me a doctor. So general practice is very deep than what it is. That's why I thought that maybe I never had the help when I looked for, not even from a single person, where I just faced all the struggles by myself. I thought that maybe I can be help at least to one person. That's more than enough. And I'm not sure that my Instagram page will grow such big. I just thought I can help at least a bunch of people. It's fine now. It is somewhere around 11,500 followers, and I'm very happy that so many people are stuck in their one, and I could be the help to them. So this is why I choose general practice, and with less clinical experience, like after you finished internship or maybe 2 to 3 years, the jobs are comparatively very harder to the people who have experience, but still you can get it. The only thing you need is patience. Applying jobs and jobs, do not expect you to get a job if you have applied less than 100 jobs. So your goal should be at least 100, 200, or even more, depending on your luck, timing, and where you're hitting for. Either it is hospital, either it is general practice. So if you're ready for that, you won't get disappointed, and at least 6 months should be the time minimum for you to get at least response for your CVs and job applications. This is what I suggest. If we have any more questions, we will go forward and explain. If not, I think this is what I want to share to all of you today.
Ma'am, one more question.
So
Ma'am, what advice can you give to FMGs who is preparing for AMC one in
FMGs, I can
past
say
year?
that you have a small slight disadvantage regarding the continuation of the work. When you're FMG, when you're outside of India, you're stuck, like you cannot work in the country that you have finished your graduation. Not possible for everyone, and the India process is hard again. But don't get discouraged. I think you do have two different pathways, as Dr. Faisal has shared in his channel. Like, what if you want to do with from India experience, apart from India experience, you can follow that. Except that there is no other difference. It's same for every IMG. So you are an IMG to Australia. You are just an FMG to India. So it only involves India, and a slight disadvantage of the continuation of work, the recency of practice, or the gaps that you should maintain. So if you're planning from long time, just like in third year, final year, if you decide like you want to come to Australia, then make a proper plan how to fill those gaps. Where do you want to work? How to work so that your CV is rich. You can show better credentials in your CV. Apart from that, every other thing is same, because you're an exact IMG to Australia. You are a person who have not studied in Australia. You're outside. They don't care if you're an IMG, FMG, everything same. This is the only step you need to take care of. And I think for this, Dr. Faisal is helping everyone, so you can check with him.
Yeah, ma'am. Last one more question. So, this is also one question I got from the group. Like, what is the salary scale we can expect as a GP in Australia?
Okay, so this is a tricky question for me to explain, because this is not a fixed salary like as in hospital, but definitely you'll get more than hospital. If it's somewhere around 85,000 to 90,000 in per annum Australian hospital salary, you will get at least starting from 100,000 or 120,000 and above it, depending on how hard you work, how many days you work. The reason why it is, when the general practitioner works, they work in the community and the bills are different. So if you see a person for 20 minutes, the amount you get is different, the pay is different. For 40 minutes it's different. For care plans it's different. For mental health care plan, GP care plan, menopausal, so there are very different types of sections, how you see the patient, why you see, and you will bill Medicare or the insurance that pay you accordingly. So no patient pays from his pocket. Either they have Australian Medicare insurance card, who are for permanent residents and citizens, or any private insurance. So you bill them, you'll get some money. If you see like 30 patients in a day, out of that 30 patients bill you have made, you will get 45 to 55 percentage of the billing that you have made on that day for you. So this is how the general practice depends. And if you work in MM1 DPA, the pay you get from the Medicare or other persons are different. If you work from MM2, it's different. MM3, so the salary varies if you're going to rural. So the it's basically in a whole day, if you have seen 30 patients, this whole sum of the amount percentage billing you get. So if you don't work for 5 days, if you're sick, you won't get salary. It's not a fixed one. So it's the percentage of billings. That's why explaining GP salary is tricky, which I am going to decode a lot in next few days in the channel when I am doing the videos. But the basic is this: for a round figure, if you want me to say, it's somewhere around 100K and above.
No,
Basic
but
with 100,000.
basically, I was asking like after tax and everything, how much around how after tax and everything, how around how much you will have in the hand if you get a X amount of money,
Around
how much
90,000
percentage
to 100. Sorry, yeah, yeah.
you get an X amount of money in your hand, how much percentage you will have in your hand after your all the bills and after your all the if you're a normal person.
That is tricky. Again, where you live, your bills, area
Yeah,
to
but
area, state to state
around
matter.
can
But
we save
yes,
up to 60% in our hand like that? I'm asking. After
60.
after tax
No.
and stay
Okay,
normal.
after tax, I'm saying that you get 90,000 to 100,000 basic per annum.
Okay.
I can't
After tax.
decode it per month. It's after tax. But the
Okay.
thing is, you will get together with the tax when you get paid in general practice, where you need to pay the amount that you get. You need to pay later. So if you say after tax, it will be 90,000, 200,000, depending on how hard and how many days you work. So it's minimum of
That was the
90,000.
exact question.
Definitely, you'll get it. It's even
That
more and more if you get the trick of general practice, if you get how to see the patients, if you get the knowledge of how to bill accordingly, appropriately, it definitely raises up to $200,000 per year also. But you need experience. It at least take 5 years for you to understand and raise that bar to 100,000 to 200,000. That gap 5 years, and you need brain. You need to finish your FSP or AGPT, enter into any fellowship. So it varies. It increases, but basic is 90,000 to 100,000 per annum. I'm sorry, I can't remember per month how it
okay.
can be,
It's okay.
but
It's
yeah,
okay. No problem. Yeah. So we'll ask any of our members to ask any doubt, like one or two questions.
sure,
So I hope it will be okay with you, ma'am.
sure, definitely.
Yeah. If
Why
anybody wants, they can turn on their mic and ask the question.
Uh, Hello.
Hello,
not?
ma'am.
Hi.
Hello, ma'am. So I heard that after we finish our AMC part one, and we can get a job offer from Australia. But I also heard from of mine that we won't be able to do resident even after we complete AMC. You know.
Sorry, there was a disturbance. Can you repeat the question again if you don't mind? Sorry.
Okay. Is it true that if we finish AMC one and take a job in Australia,
Mhm.
that we won't be able to do residency after that, even if we complete AMC two?
No, if you complete your, so I'll tell you the criteria. If most of the residencies, most 98% of the residencies for any branch, you need AMC 1, AMC 2, and 1 year of experience working in under supervision in Australia. So you have finished your AMC 1, you'll come here, you work more than 1 to 1.5 year, you will pass AMC 2 in the meanwhile, and you will get general registration. Then you are eligible for residency pathways. But there are some internal rules, like how many years of experience is your clinic or is your hospital accredited for the PG standards. So there are so many internal things that you will face, which is very hard to explain at this stage, but that is wrong. When you come here on the AMC 1, if you finish AMC 2, you'll get general registration. Having general registration gives you more independence and freedom to choose anything you want, and you can enter post graduation. Definitely there will be some internal small things and changes every semesters, that they have intakes and problems which can be resolved definitely when you are once inside Australia, but that is not true.
Okay, thank you.
Yeah, hello,
Uh,
ma'am.
Hi.
Ma'am,
Hello.
can I ask a
Yeah,
question?
sure, you can.
So, first of all, thank you so much for hosting and coming to this webinar.
My question to you is, I have heard that most like IMGs, specifically Indians, they don't get into clinical branches of residency or post graduation, and they get to go for non-clinical branches such as GP, radiology, or some other kind of consultancies. So, is it like is it true that this is happening, or like can an Indian passport holder like myself and many others can actually become a surgeon, a practicing surgeon in Australia?
So the very first thing I will correct you is general practice is actually the clinical branch because it's the mix of everything in family medicine, which is very less appreciated in India and very less used. That kind of system is used. So that is the clinical branch. Second thing, radio. No, I have not seen anything like that. I have seen even a lot of Indian surgeons here. But the thing is, when you are an Indian passport holder, you cannot not exactly Indian passport holder, if you're not a permanent resident for few of the surgical branches, you cannot get the eligibility. The basic eligibility is you being a permanent resident or you being a citizen, so you can go into the surgery or other clinical branches. But again, as I said, the internal rules for you to get a permanent residency, it's not hell of a big problem, to be frankly speaking, because you need general registration to be able to get registered, apply for permanent residency, and you can get it because most of them are looking for healthcare professionals to improve in Australia, to get that stability in Australia. So recently in Victoria, in the recent permanent residency application, and when we assess the system that has gone happened in last few days, 80% of the permanent residencies were granted to healthcare professionals, which were doctors, nurses, aged care workers, and all the ones involved too. So, no, that's not true. You will have your struggles here when you come because AMC is the very basic struggle you'll go through. But that doesn't mean you can't go. When for surgery or any other big branches like this you're talking about, they at least need 3 years, 2 to 3 years of experience working in Australia, general registration and permanent residency, and furthermore rules. But it is definitely possible. You need to have some patience. That's it.
Got it. Sorry for the inconvenience. Thank you so much.
That's fine.
Hi, ma'am.
Hello,
Hi.
Am I audible?
Yes, definitely. Yes, sure.
Yeah, ma'am, my question is like, do this pathway, the AMC pathway, is same for the GP and also the post graduation if we decide to uh, do in Australia?
So, general practitioner is a specialization course. You won't become a general practitioner if you
Yeah.
don't do fellowship. It's a post graduation another branch, but that branch occurs outside of Australia, outside of hospital, as clinics where you don't have emergency setup or you don't have admitted hospital setup. That's it. That's
Okay.
the only difference. So can you repeat your question again, just so I think I lost
Yeah.
track.
Is this path the AMC pathway is same for the GP, and if we decide to do any other post graduation departments or branches, if we like to do, so the pathway is the same or
No, the pathway is not same. Different branches, different pathways. Even from one to other pathways, it's different. The requirements is different. General practice are clinics outside of hospitals where you need to apply for that jobs. That criteria you should follow, and all the other ones in the hospital, and that ones is different. That is what I am saying. You can't get a GP job while applying to the hospitals. You can't get a hospital job while you're applying for clinics. Both are distinct.
okay? Okay. So my other question is, ma'am, like I have done my MBBS from China, and due
Mm.
to COVID, I have done half of my internship in China and rest of the internship in India.
Mm.
So will that create any further disturbances for this pathway?
I don't think so because your situation was because of a pandemic, which was in none of the humans' hands. So
Yeah.
no, I think it won't affect your CV or
Okay.
anything.
So
But
one
you need
last
to
question.
finish your internship somewhere or the other. If you've finished
Yeah.
it, that should not be a problem.
Okay. One last question, ma'am. So for this GP process, how if I start from now, how much time will it take to get the GP?
So you have not finished your AMC 1 exam, am I right?
No. Yes. Yes.
Yes or no? Sorry, you're finished or not finished?
No. No. Not yet finished.
Not yet finished. So maybe at least 2 years, because any of the process like UK, US, Australia, they are not so easy. There will be obstacles every stage. So we don't know where you will be stuck. My personal suggestion is at least 2 years.
Okay. Okay. Thank you so much,
Ma'am,
ma'am.
I have a
That
question.
was helpful. Thank you.
Sure.
Ma'am, after, let's say if I complete my AMC part one and afterwards I do get a job. So what's the procedure for like going to Australia? Basically, do we have to apply for job visa in order for us to go to Australia? Or like I've talked to some consultants, they are saying that I have to take a 2-year degree in order to get a student visa and to go to Australia.
Sure. Can you just give me a second? I'm really sorry.
Ma'am, if possible, I can explain this thing if it's okay.
Yeah,
Like,
yeah, you can. Definitely. You can, Faisal.
yeah, because she's also a little bit busy. I'll explain these type of doubts. Like, you don't have to take any student visa to go there. If you get a job, hospital will give you a work visa. You have to apply the visa. Means they will give the documents. You have to apply for work visa, and it will you have to do upper registration also if you're getting a job, like limited registration if you're going after AMC one. And basically, what happens? It will take 2-3 months. You have to take PCC, police verification, from a place where you stayed within 1 year. Like, after your 18th birthday, wherever you stayed more than 12 months, you have to take PCC, that is police clearance certificate. If you're FMG, you have to take from the country which you studied. If you're from India or study from India, you can take from India only. Otherwise, if you're an FMG, you have to take from the country which you studied and from India also, because you will be staying more than 1 year in India. So both of the PCC we have to do, and APRA will give a list of things which you have to do while applying for limited registration. Then you can directly apply for visa, and you can go to Australia. You don't need to pay any money to any agencies or anything. You can just apply with your normal visa fees, and you can directly go to Australia. There is no need of any other things. Those who are saying like you take a subject or any course and go to Australia, it's unnecessary. If you already have a job, you don't need to take any other course or anything by paying money. Basically, agencies try to take or get money from you. So follow the pathway, and if you have any doubts, you can ask in the community, or you can directly message us like this stuff. First, clear AMC one. Don't worry about the stuffs. We will help you with all the doubts in coming things. Because if ma'am is speaking, try to ask doubts to her after AMC one. What you will do in Australia, like that doubts you can ask her. Other doubts, we have other speakers also. They will clear for you, like how to do the AMC and all AMC one till AMC one and registration. They will speak. If you have more doubts about after AMC one and after job in Australia, that doubts you can ask to ma'am. Okay.
Okay.
Yes, Faisal. You explained it very well. One suggestion here that I say that 99% of any of the agencies don't know what happened in Australia. Even some of the doctors who are working here are not aware how the system works, so they don't know. Do not believe any agencies until unless that's run by doctors who are working here in Australia. I don't suggest any agencies.
Okay, ma'am, I have another doubt.
Sure.
If in my CV there is, let's say, a clinical observership of US and I have some research paper, would that be a plus point for me to apply jobs in Australia?
I don't think so. Clinical observership is not counted as an experience, which is clearly stated somewhere. I don't remember exactly, but it's something which can help you fill that gap, and gives you like research paper. Also, it's not mandatory. I have seen many, many, many people who come here, including me, who doesn't have a research paper. So research paper is not mandatory, and if you have, that's good. You can just show, enrich your CV. But the other question you asked is, sorry, I missed it. Sorry.
Most important part is clinical experience, right,
Observership,
ma'am?
observership. That observership matters when you're in Australia and when you do it. But if you're in India, just traveling with all that money to do observership in Australia, that's not worth it.
Okay, thank you,
Hello,
ma'am.
ma'am.
Yeah.
I have doubt. Like, uh, can you tell what are duration of residencies?
Okay, good question. So general practice 3 to 5 years, depending on how rural city what you choose. Um, General practice 3 to 5 years. Any other residencies apart from general practice 6 to 7 years.
Okay, ma'am. Thank
Yeah,
you.
hello, ma'am.
Hi.
Yeah, hello, ma'am. Myself, Dr. Prasad.
Hi.
Yeah, actually, hello.
Yeah.
Yeah,
Hi. Continue. Go
my
on.
voice audible.
Yes. Yes, it is.
Yeah, ma'am. Myself, Dr. Prasad. I'm from. So I completed my post graduation in community medicine, MD community
Oh,
medicine in India. So
yes.
I'm planning to come to Australia through AMC pathway.
Hmm.
So how is this degree helpful that ma'am to get that say residency or a position job, general practice in.
Your degree will help you to get a job in Australia because your degree is not valid here, so you can't be a specialist here. You'll still be at the graduate level because I have seen that whatever the courses, DNB or the other courses of community medicine you do in India is not valid for Australia, which I have confirmed with other doctor also. But when you say it is community medicine, you enrich your CV saying that you work from long time in general practice, you have this experience where you can even apply under limited registration of area of need for, since if you have more than 3 years of experience, where it can fetch you a bit more, maybe if you ask me 3 to 5% of additional benefit, but not it doesn't give significantly much difference. Your experience helps you to get a job, but still you need to do another residency here as a general practitioner, finish the 3 to 4 years, then only you will be called general practitioner here.
Okay. So
Hello,
only
ma'am.
ma'am, this AMC one and AMC two is the only interest to come there, and after that we need to do again residency program, 3 years to
Yes.
4 years.
Yes. Yes.
Okay, thank you.
Hello, ma'am.
Hi.
Hello, ma'am.
As we are a FMG here, we have got gap for giving a exam of FMG in India. So what we can to boost our CV and use for Australia if we want to do AMC.
Dr. Faisal, I think you're in that stage where you passed. Do you want to answer his question?
Yeah.
I think he's the right person to
I'll answer
answer
this.
this question.
I'll answer. I'm making a reel about this also. Next reel is about this stuff. But I'll answer this question. Guys, I told you, ask her doubt which is after you clear AMC one about job and residency or something like that. Because we have three more speakers who can talk about these stuffs. Don't worry. We have people who are ready to talk. So ma'am is little bit busy also. She's having on a vacation. So please ask her a question which is more relevant to things which are after your AMC one when you're getting a job in Australia. After you get a job like residency or about GP or something like that. Okay.
Hello, ma'am.
Hello, ma'am. Very good
Hi.
evening. Ma'am, I would like to ask a question.
Sure.
Can you please, ma'am, state the difference between a GP and a RMO post in the Australia?
Yes, so just to everyone to understand how healthcare system works here, there are two different types. One is general practice setting, other is hospital. Every person, until unless it is emergency, will go to a general practitioner. So general practitioner is a trained specialist in family medicine for 3 to 5 years, which is equivalent to internal medicine in India. So similar to equivalent to internal medicine, but it only has adult medicine where a general practitioner will see every thing in the general practice, like all pediatrics, gynec, or all the other things. So then, if the case is out of the scope of general practice treatment, which requires specialist management, maybe like endometriosis, uncontrolled diabetes mellitus, or maybe heart disease, anything that's advanced, where general practitioner make a route referral to the hospital specialist who treat that case or that specialty, and they discharge back again to the general practice where it's responsibility to continue the aftercare. So basically everything will be managed by a general practitioner. In the interim, for other specialist opinions, medications, any guidance that's required for advanced cases and everything, the patients will be referred to the hospital. So that specialist will be maybe an internal physician, general surgeon, cardiologist, endocrinologist, surgeon, or anything they can be. So if you want to go into that branches, you'll start job in the hospital. So that junior position in hospital in all those branches are called RMO, where if you do that junior doctor position in a general practice setting, which is called GP, non-vocational GP, or this whatever terms we call.
So, ma'am, basically after clearing the AMC one, we get the post of GP or RMO there.
Guys,
Both are different. You can get anything. That's what I am saying. Both
yeah,
are different.
these questions I will explain. Don't worry. We have people. They
He-
will explain.
Hello, ma'am.
Okay.
Hi.
First of all, thank you so much for having a session and taking out some time in your vacation. Ma'am, my question was like I've heard that recency of work is of very importance in our CV. I also I'll take like 2 to 2.5 years to clear AMC 1 and AMC 2. So while applying for the job, I won't get any time for to work in a hospital and like put it into my CV because I'll be studying for the exams. So what do you suggest? How to fill this gap about work and how many months of work should be needed? Like, is there any specific time that in 3 years, minimum of 2 to 3 months should be work or should be there?
So the best suggestion, if you ask me in that scenario, is to work somewhere in a low-key place and still prepare. I mean, like taking time out completely to prepare yourself isolate is not a very good thing because clinical practice is very important, even if it's full-time or part-time. By any chance, if you have that gap, you need to maintain an appropriate Australian CPD point, which can be through few websites. Those websites will be shared soon, like Think GP, Medicine Today, or anything. Every year, at least you need to maintain 50 to 100 CPD hours to show them that even though you are out of clinical practice, your clinical knowledge is up to date, where you are doing all the requirements for it. But that's not ideal. I won't suggest it. Even if you work part time 3 hours somewhere, it will be considered as a job, and it's better maybe 3 days a week, 4 days a week. That is the best option if you ask me. But still, if not, you can show the research papers, observerships, you can show the CPD hours. But if you don't have that job experience, you will be anyhow disadvantaged how many you will show in your CV to them.
Okay, thank you, ma'am. Ma'am, also, like, is there any specificity that we have to work in a specific department, or like, is it okay that I work in a hospital just as an MBBS doctor, or is there
uh,
any specificity that medicine department or emergency department?
yes, so recently I've had a chat with a doctor who works as a JMO in a hospital. Just give me. So I've recently had a chat with the junior medical officer. They said that you will be given options how to work, like surgical stream. So all your RMO positions, duties, or the branches that you do mostly towards the surgical medicine, or general, where if you have not decided which branch to choose for your post graduation. So according to that streams, you can choose and finish your rotations as your choice and as how they give. So this is what I've recently heard.
Thank you, ma'am. Thank you so much for answering.
Hi, ma'am.
Ma'am,
Hi.
I would
Uh,
like to ask
Yeah.
one question more.
Sure.
Ma'am, basically, like after clearing the AMC, like my basic will to be like I want to be a pediatrician.
Okay.
So like after clearing the AMC one while working there, by giving the AMC two, like can you please clear out the pathway like to be a become a pediatrician in Australia?
Okay, so the pathway is you will start as a junior medical officer in the any Australian hospital. You'll finish your 1 year of rotations as per the hospital suggest you for the pediatric stream wherever you should work. After you finish those, you need to have at least few years of experience. So you'll have a fellow Australian College of Physicians, FACP, I think so. Sorry if I quote it wrong, but fellow Australian College of Physicians. In that, when you go, there are some criteria for the ones who are applying for basic physician training. So first you'll finish your basic physician training, which will be 3 to 4 years with your exams that you finish. And then later, from that basic physician training, you will choose your specialist, which you don't need any special exams, which is an integrated program here when you want to become a physician or pediatrician, which is 6 to 7 years directly, where you will be specialized out as the super specialty when compared to India. So you'll finish your basic physician training. After 3 to 4 years, you'll be given options like cardiology, endocrinology, pediatrician, and so on. Accordingly, you'll choose that. And in 6 to 7 years, including the exams and procedures, you'll become a pediatrician. That means at least 2 to 3 years of experience as medical officer, junior or senior together. Then applying for the physician training in the meanwhile, getting into the program 6 years, 1 year spare for the exams. Then you'll be a uh, full registered accredited pediatrician, until which you'll be pediatric trainee or the registrar or whatever the names they have in that roles.
And isn't it possible, like after clearing the AMC2, I can directly opt up to pediatrics?
No, I think so. You need to go through the physician training, then only you can. It is in the fellow Australian College of Physicians. So if you open, if there is any change, you can see, but it's an integrated program in that physician only. It's not something separate. As far as what I know, the knowledge.
And ma'am, like as in current time, you are a GP in Australia. So
Yeah.
like, what's your like future weight? Like, you want to do any specialty there, or you'll be like GP there?
GP is a specialty which I was saying. General practitioner is a specialist program of family medicine, which is 4 years, including the exams, which are very, very hard. So yes. I'll do my specialty in the general practice and be a full registered general practitioner. Now I am not full registered. I am non-vocationally registered, which is junior medical officer in general practice.
Okay. And ma'am, like I work in India as an locum officer, as a locum doctor. In some of the hospitals, I have the experience of the different branches. So like, can you please say like, is it any benefit I get to apply there?
Um, I don't think so. Everything's same. It's like how you show your experience to that one particular person who wants to give the job. You need to just, like, if you're applying for general practice, you need to understand what Australian general practice is, maybe from Google research. So you will include those words in your CV saying that I have so and so experience of these branches looking for a general practice. If you're looking for a hospital job, I have so and so experience in these jobs where I have very much experience that I can manage hospital cases, emergencies, and everything, and so and so. So it's just in your CV. It's not practically very big difference.
Ma'am,
Hello.
ma'am, can I ask you a question? Hello. Hello, hello. Can you hear me? Hello, ma'am. Can I ask a question?
I can hear
Yeah.
you, Dr. Faisal.
Just Rohit, just 1 minute. Ma'am, this will be the last question from our group, because
Sure.
we have a limited time, and we'll ask others also to give us some small time to talk. Rest
Definitely,
everything, don't worry,
definitely.
guys. Ma'am will be sharing everything in her Instagram pages. I will also share that in our groups. You don't have to worry. And other things I will also share in my Instagram also. So all the information which she is already sharing, she will be putting in reels, and she is very good at it, and you can watch her Instagram, so don't worry about that stuff. Okay, I will be also personally sharing in all my groups also, so you don't have to worry about this stuff. She will be available, and she's a very kind person, so you don't have to worry. And I am doing like this because we have a limited time, and I told her you only have to speak 10 minutes, but literally she's putting so much effort and speaking like nearly 50 minutes right now. So that's why. And I know you guys have so many doubts, but sorry, we have a limited time and limited things, and she is explaining so well. I don't want to stop also, but this is a very good information for me also. So, but what we can do, we have a limited time, and everything is like this in our life. So, better, this will be the last question. Rest every questions you can send me personally. We will be putting reels about that question, so it will be easy for everyone. So that will be better, because we will also have some content to make also. Like your common doubts will be our reels. So if those who doesn't get chance to ask question directly, they can send me the questions. I will send to ma'am, and whichever I can do, I will make. Rest ma'am will also make. So don't worry about that. Okay. So Rohit, you can ask your question. So that will be the last question from our group. Sorry, other guys. I'm really sorry. Rest our other speakers will also speak few words about AMC one also. Okay.
Hello, ma'am. Thank you for taking your time. So, actually, I wanted to ask you that I'm actually a resident doctor. I'm currently doing my internal medicine residency here. So, if I say pass my AMC exam, say within the 5 months, and then after that my residency will be done. So, will there be any advantage? Say I get MD degree from India. So, will that add any boost to my CV? Or I know I'll have to repeat my residency if I want to do internal medicine there again. But I just wanted to know if the MD degree from India would add some boost to the CV.
So the thing is that you cannot work as an specialist here, which you already know about it. When you're applying for junior medical jobs, so you can state that you're interested in medicine stream and you have already done your residency back in India. So you do have a good experience and knowledge, and it gives you somewhere 3 to 4 years of extra experience apart from your graduation, internship, and the other work. So in that way, it helps you to get into the hospital jobs. As I said, it's how you portray yourself in the CV. You will write everything convincing that that the employer who are seeing your CV should feel like this is the guy I want. So that's how you need to make it. You need to shine it in the way that you're born for internal physician, and if they don't take you, they should regret for it. I mean, you should not say those words, but I'm just saying your CV should be in such a way that can be, I mean, like, you can get benefit in that way, where you can show that you have 3 years of exclusive experience and residency experience back in India. So it fetches you job 5% or 10%, depending on how you make your CV, but no other benefits you have from it.
Okay. Thank you.
Thank you.
Hello,
Hello, ma'am. Thank you, sir.
I
Guys,
have a
guys, go on, go
question.
on, please, please.
I
Uh,
think I am very, so what I will do is that I am very happy to give the time to the other speakers. If any of the points I think I should add up, I will unmute myself, ask for the permission from the speakers, and give you that. But now my other AMC aspirant speakers who are there here to guide you will help all of you. If you're still worried what to do, you can just check Dr. Faisal's Solo Sailor. He is doing very, very, very amazing good job. I think out of all the creators who are doing the AMC content or helping AMC, Dr. Solo Sailor or Faisal is very genuine. That is 100% I can say. So I'll give stage to them, and if there is anything extra, I'll add up. Sorry guys, you can check Dr. Solo Sailors and my page also, which is Aussie GP Diaries, for all the other information.
Thank you so much, ma'am. I'll share the links of the via Instagram group also in our groups. Instagram links in the groups. You don't have to worry. And Mama, I'm really sorry that I cut you down. But last your question, I 100% I'll give you answer, or I'll ask her and I'll personally give you answer. You don't have to worry about that. Just write me the question, okay? You can write me in the Instagram group or WhatsApp or DM me anywhere. I think you have my contact, so don't worry about that stuff. And see, we have limited time. That's why I'm doing like this. I'm really sorry. And thank you so much, ma'am. Thank you so much that you have given me this much effort to give this much time. And guys, sorry, uh, guys, we will welcome. We have like Dr. Ann, Dr. Dhruv, Dr. Aditya, Dr. Pooja in our call. Pooja is having some issues, but I think rest everybody is there. So I'll ask if anybody have see reaching Australia is second thing. First you have to clear AMC one. Okay. So first goal should be clearing AMC one. Second goal should be everything else. So you have to know how to clear AMC one. So I called especially ma'am to give an idea how your life after AMC one and how everything. But see, first of all, you have to know what is AMC and how you can crack AMC one, because without AMC one, you can't do any of these steps. So that's why I called all other doctors who have recently passed AMC one, because the criteria is changing, the questions are becoming more tricky, and we invited some FMGs and IMGs also, because our audience is mostly FMGs and IMGs. So that's why I called half of IMGs and half of FMGs. So we know like how to think and how to help you guys. So I want to ask Dr. Dhruv. Hello, Dr. Dhruv.
Hi, Faisal. Hi.
Yeah, he studied from India and he passed his AMC in November. And he's a very good friend of mine, and he was a community member, AMC community member, who first member to pass from our community. And he's an excellent student also. So he will introduce himself and he will say few words about AMC one and his journey. Okay.
Yes, thank you so much, Faisal. Yes, I have done my MBBS from BSA Delhi, Baba Saheb Ambedkar Medical College, and I passed in 2025. And after that, I gave USMLE Step 1 and I passed that. Then I changed my plan and I completed AMC 1. And I took guidance from Faisal as he was senior to me in that. And he told me really the major points that really helped me during the exam, like the way to approach the recalls and the topics and the last month strategies that really helped me. And if you guys have any doubts about that, I can definitely help with that.
Okay. Anybody have any questions to Dhruv, Dr. Dhruv?
Yes,
Hi.
sir, I would
Hello.
like to ask a question.
Yeah, you can ask.
Dr. Dhruv, can you please tell me like what are the sources you used for clearing the AMC one?
Uh, yes, I used notes, my notes, and I used steady study notes, and I've solved eMedici question bank. Majorly, I used only these two. I haven't done any that John Murtagh or those books. I've mainly done these two, and I solved around 3,500 questions from eMedici and gave all the mocks. And I used first aid also for my basics.
Okay, and
First aid,
like how much time did you give to for your AMC one preparation and after before giving this before
I
giving
took
this exam?
around 5 months.
Guys, there is. I want to add one more thing. He cleared USMLE step one before giving MC one. Okay, the level
Yes.
of knowledge difference is there is small difference, and his notes and all the notes are from John Murtha and modified.
Oh,
So he doesn't read book directly, but some informations are from John Murtha and
yes,
guidelines of Australia.
definitely.
Okay, so you
Definitely.
can't avoid the book, but see the I am sorry for interrupting, but most important part of this thing is that you need to have a base knowledge. Dr. Drew's
Yes.
base knowledge is so good, so it was easy for him. Okay, so if you have a very good base knowledge, then you can add upon the notes and all the MCQs.
You
Otherwise,
can
you
have a
need to
good
prepare.
idea about your base knowledge once you start solving your eMedici question bank. Then you can get a good idea that what is the level of your base knowledge. And if you think you have a good base, then you can just go with your notes and Q bank. And in 4 to 5 months, you'll be good to go.
Sir, I would like to ask one more question. Like I have attempted AMC one like a few months back, and I got a score of 222.
Okay.
I'm not able to clear that, so I'm again starting my preparation like in from 5th of March. So any suggestions would you like to give me like so that it can help me?
What all resources you use during that?
I basically use Meru for
That is the
all the
first mistake.
lectures and sorry.
Okay.
Maro won't help for AMC, bro.
Yes, yes. I also tried doing that earlier. I also started reading from dams and marrow notes, but the
Mhm.
the information is not different. But the point is, you need to prepare for that specific questions. The questions are asked in NEET PG are in different form, and the questions asked in AMC one are way too different because they are NEET PG is more about facts, and AMC one is more about your clinical knowledge. That's why that knowledge is not complete when you read these AMC, these marrow notes. So you need to refer something like if you read the guidelines directly, they are in the form, they'll tell you the next steps in that manner, which you need to follow in the clinics itself. Then you'll be able to solve the Q bank in a better way.
So can you please like tell me one or two like major sources which I can use to improve my score?
Uh, I used study notes and eMedC QBank, and you can also use AMC Catalyst notes also. They are also really good. If it will take some time to launch them, but to launch those
Yeah,
notes.
we are making a note for you guys. Don't worry. We are launching something. Okay. We are combining all the notes together from all the major coaching and all the guidelines, updated guidelines and everything. I'm consistently working on it and being talk with all the doctors like who already passed the MC. We are cross checking it and proofreading it. I will show you at the end of this webinar. Okay, don't worry about that. About the source. Always AMC MCQs. eMedicine is one of the best source to do PYQs. Like means not PYQs, QBank, because it's very updated and you will get some exact same question from eMedC. Second thing is, did you do done recall questions
Yes, sir, I did.
like from AMC success?
Yeah, from the MC.
Yeah, so if you are lucky, you will get around 60% maybe recall questions, 60 to 70%.
Yes.
So
Yes,
to
yes, yes.
understand that recall questions, you need to have a proper knowledge because you can only just watch that question. You can't study from that. In the end time, you can only just read through it. If you already have a knowledge, you will know how to do that question. Okay. The problem which you had with your exam was, I think, I don't know exactly, but what I think was your source was not proper. The way, like already Dr. Dhruv explained that the NEET PG and FMG is basically fact. But AMC, they check, are you eligible to work as a doctor? So they will ask clinical scenarios and they will, your most important part is your critical thinking in AMC. So
Yes.
your base should be very strong. Plus, you need to know all the steps of that topic which they are asking. You don't have much topic to study, but if you are studying one topic, you need to know all the steps. Like even the 10th step also you have to know. Then only you can crack this exam. It's getting more and more tricky nowadays. Okay, because last year so many people passed the exam, so they are making it. They said they are not making the cutoff high or they are not making the exam difficult. But literally, what they are planning is that they are increasing the standard by increasing more standard question than earlier. You're getting the point. And
Yes,
Dr. Dhruv have explained it very well. Thank you, Dhruv.
Thank
Okay.
you, sir.
Yeah, and
thank you, sir.
I'll welcome Dr. Aditya also. He's also one of my friend who cleared AMC one and he's planning to write AMC two soon. So if you have any, hello, Dr. Aditya, are you here?
Yeah, hi bro.
Okay,
How are you? How are
okay,
you
Dr.
doing?
Aditya.
Am I
Yeah,
audible?
yeah, you're audible. I think Dr. Aditya will explain everything. He's also one of our community member and he's a very nice fellow. So you can ask your all doubts about AMC one and how to book AMC two. He's going to write within 3 months, so 3 4 months. So let's see.
Thank you for your intro, Dr. Faisal. That's so nice of
Hello,
you.
doctor.
Yeah, yeah.
Can I
Hello,
ask
hello.
one question?
Please let him
Uh,
introduce himself. Please give him 2 minutes.
People are
yeah,
so enthusiastic, but that's okay. That's fine. So yeah, I'm Dr. Aditya. So I'm an FMG. So I passed from Dow Medical School Foundation. That's from Philippines. So I started preparing for my AMC from 2025 around like April, May month. And first I booked my exam on September, but due to some personal constraints, I had to push it to the October. So and then I passed my exam in October. So now I'm planning to take the AMC 2 as well. And I'm so happy to share that one more information, Dr. Faisal. I'm moving to Australia very soon. So most probably I'll be moving towards Melbourne by around March 30 or 31st. So I'm just making
That's great.
arrangements accordingly. Yeah.
Yeah.
So, so if anyone have any doubts regarding AMC1, AMC2, you guys can ask and I'm open to questions.
Hi, Doc.
so doctor,
Yeah,
Yeah.
hello. Yeah,
hello.
tell me.
Am
Yeah.
I audible?
Yeah, you are. Yeah,
Yeah.
go
So,
on.
I haven't started the preparation for AMC one. So I'm
Okay.
planning to give the AMC one in very soon.
Okay.
So yeah, what is the basic step or what is the base from where should I start the preparation seriously?
Okay, that's a very nice question. But before that, let me put very certain things very clearly. Since
Yeah.
even Dr. Deepthi even mentioned about the epic verification, right? So before
Yes.
you guys sit for any sort of preparation for AMC, Since like
Okay.
it's a very basic logical thinking. See, you're migrating from one country to another country entirely. So
Yes.
before start preparation for any sort of exams, you need to make sure all our documents are verified and everything is done, and then
Okay.
go for the exam. So in your case, if you're done with epic verification and AMC portfolio making, it's fine.
Mm.
You can
Okay.
proceed to your exam, and then you can sit for your preparation, and that's well and good. If you've not
Okay.
done any of these steps, you have to first go with the epic verification. It will take some time. Like in my case, it took me
Yeah.
around 40 to 45 days. And
Okay.
then, but there are a lot of worst case also there. So first do the epic, go for the AMC portfolio, and then go for the exam prep. So that's the proper way to travel in this journey.
Okay.
Yeah.
So for the preparation, what are the suggestions you would give me, like to follow which books?
Okay. For the preparation, what I will suggest you is see, I'll tell one thing's very straightforward.
Yeah.
Don't rely on Marrow, the very first thing. Don't
Okay.
rely on Marrow, don't rely on dams, and don't even rely on any sort of Indian platforms that teach for students over here. You
Okay.
can use Dr. Faisal's flashcards, Dr. Faisal's guide that are being shared in the group as well. And
Okay.
then if you want to invest a lot more knowledge on yourself, you can use
Okay.
John Mutta. It's a very base thing and very base, most importantly, asked areas where you can find in the book and you can
Okay.
read from there as well. And for every single topics and every single clinical stuffs, what we have to do is
Yeah.
we have to make sure we go through at least once about the RACGP guidelines for the adult and the RCH. That's for the pediatric stuff.
Okay.
So these two guidelines are very much important to solve every single question that's gonna come and pop in front of your monitor.
Okay.
So this is how we have to keep your prep.
Okay.
I'm talking about the source. And for the platform, I will just blindly suggest go for Remedicide subscription. That's the
Okay.
best platform subscription you have. And try as much as possible to solve questions every single day.
Sure.
So, yeah.
And
Thank you so
Hello.
much.
Good
one more
evening,
thing,
sir.
one more thing. After our Dr. Aitya explains all the guidelines which he explained and all the books he said, we already after the webinar we are giving out a AMC guidebook free for everyone. In that I have put all the websites, major websites he told, and all the books which he told and everything he told. We will be giving out the PDF of the AMC guide also. So don't worry about that. Whatever he told, all the website which is already there, don't worry about that stuff. And for EMC also, if you're planning to take, we have the link also. So two things is sorted out for you guys, so don't worry about that stuff. And listen carefully what he is doing, because he is the one who is recently passed and is more towards the pathway like closest to us. So listen carefully what all points he is saying. Okay, and especially he's an FMG also, so it will be very helpful for many of the people who are attending the webinar.
Hello,
Hello.
sir.
Hello, sir.
Hello, sir.
Sir,
Hello.
am I
Good
audible?
evening. Hello.
Uh,
Sir, can
One
you
at a time,
please,
guys. Yeah,
sir,
yeah.
Hello.
because we are
Uh,
talking about guidelines, can you just tell us how to approach the guidelines? Because a lot of information is provided
Okay.
in the guidelines. So, like, how to approach the guidelines?
Okay, so in that case, I'll just make it very quickly because the others also have to talk. So, in that way, for example, if you take cervical cancer, there is a guideline which is given in the RACGP as well for that. So, it's like you have to check for like if you're gonna get a question like, okay, we have a HPV positive or it's a non-HPV, they'll be having a lot of tabulations. And Dr. Faisal, if you can just show it, just the guideline. I just explain it pretty quickly so that they'll understand how to use the
Can you
guidelines
can
for
you see
every
my
single.
screen share? Can you see people?
Yes.
Yeah,
Yes,
yeah,
sir.
Yeah, we
So
can see.
yeah, you can explain, doctor. I'll just show without my voice.
Sure,
Whatever
sure.
you're
Even
showing,
if
I'll
you want,
type.
you can. Even if you want,
No,
you
no, no,
can.
no,
No,
no.
no
It's better you
issues.
say. You are more. See, I'll just type the things and show in the screen. Don't worry. You can explain.
Definitely. No problem. No problem. think I have the guideline with me. Is it okay if I send it to your Telegram so can easily pop it out?
This is also a guideline for a postpartum from SH. All the guidelines, therapeutic guidelines also there. This is, can you see? Guys, this is guideline for RCH. I simply selected one topic as group. Then I typed RCH guideline. So if anything about group you want, it's there in the guideline. Can you see?
Yes, yes.
Yes, sir.
So
Yes, sir.
everything, every detail about all the charts, all the stuffs will be there. And about this cervical cancer, we have something called Red Book. This is from Red Book. But any topic, if you say like, tell me one topic, if anyone, I can search that and I'll show you how to read. I'll tell you, or doctor will explain how to read. Tell any topic.
Ischemic heart disease.
You can just write MI, right? Guys, one more thing. Each
We
and
don't
everything
have,
medicine
yeah,
related will
it's
be
not like we have all, we have, guidelines for every single topic. Certain things there are guidelines, but the certain things it just follows the basic theory, what we have learned in India, or whether if you're an FMG, it's all remains the same. It's not like you have a guideline for ischemic heart disease. It's not like that.
Yes, sir. So
So,
that is what I was going to ask, that
yeah,
how
maybe we can
exactly should
show
we
doctor, you
approach
can
the
go for the,
guidelines?
yeah. He just took the very right topic, aortic dissection.
this topic now. All the time there will be one question.
Exactly. Yeah, you will get. So, yeah. So this is the main part where you guys have to look out. So it's like basically we just have to understand and try to mostly memorize the measurements. So we'll be asking like they'll giving you the patient with an aortic dissection and coming for the ED department, and then they'll say the measurement values like whatever you can see in the tabulations, and then the towards the end of the question, what they will ask you is if the 2.5 centimeter or 3 centimeter you can take as an example, and what will be the next best step you should do for the patient, and what will be the next most diagnostic step you should choose for this patient. So that's how the question will be coming, and for those specific questions we need to understand these kind of tabulations and whatever the information that's given as a guideline. So this is how we have to go about the guidelines. So it's not like you have guidelines for every single topic. Certain topics have guidelines, and certain it just remains as same as the theories. That's it.
Yeah, because we are trying to make a note from all these things combined. So in that, I am trying to include the guidelines, and I am telling how to read these guidelines also. I'll teach one day in one of our session for community members that how to read and how to understand from a guideline also. Like I'll take a question and I'll open a guideline and I'll teach you how to do this, because this is a webinar. We can't explain very much in detail, but one day soon I'll talk about this, and we'll do one more section for community members. Don't worry.
And
Okay.
maybe you might not understand the concept like how I told now also, because only if you start the topic from the head to toe and then go along with the guideline, you guys will be able to correlate. If I'm gonna
Yeah.
talk just blindly, just say about guideline, you guys
Yeah.
won't be able to understand. So that's an
Because
issue.
yeah,
So,
because
sir,
when I
we
started preparation
should
also,
we mainly
uh,
refer to RSCGP or the therapeutic guidelines?
no wait,
Uh, That's
guys.
a very nice, interesting question. Dr. Faisal, I would like to talk about it. See, what I have noticed is some questions they follow RACGP, and for some, the answers are from therapeutic guidelines. So it's like we need to choose the best, which will suit the question that's gonna pop on your computer. But so far, right now, for the last 2025 year, more of the guidelines were from therapeutic guidelines. So you can use the both.
Okay, sir, one last question. So I have actually started my preparation, and I just wanted to ask, if I want to sit for July examinations, how early on should I book my exams so that I can get the last day of the month? Like, how early on should I book my exams?
Pardon, early in the sense like what are you
As in,
trying
like,
to?
how, like, for example, if I want to sit for the July examination, and like how people say that you should take the last date so that you get most of recalls. So, like,
Yeah,
how many months in advance should I book the examination?
you can book in here now also. Even now, next month, anytime, but before the window period closes. Because we have the privilege to change the exam, before the window period closes. So it's up to you. Even if you want to book now, tomorrow, or the next month, or as well
No,
as you
no,
can go for it.
no, no. Her
Because
question
the
was she
opening
want
is,
last date. Her
oh,
question
you
was she
mean
want last
the
date.
week,
So
the week. Okay,
yeah,
like
week's
that.
last
Yes,
date.
sir.
So
Yes.
Okay. For
it's
that
according to your luck,
question,
and you
that's a
have to.
nice answer. But I
Yeah,
won't suggest you to take the Monday, Tuesday, because people will get panic, in the Monday, Tuesday. The rest
I'll
of the
give.
days you can proceed.
I can give a trick which I used because I didn't get Saturday first time when I booked. I booked around Friday or Thursday. Then when exam is getting near, people of previous month will cancel. So you have,
Yeah,
yeah,
yeah, they do
you
that.
have a limit day for last day of the changing day. If you go and check on the website like regularly, if you're checking, some people will change their day to another day, another month. So there will be vacancy. So that vacancy you can take up.
But
It's
bro,
according to your
I
luck.
will tell personally one point from my personal experience. But writing an exam and preparing for it, mind wise, it's always to fix a day and just go hard for it. Because if we are planning to change, okay, we'll shift it to there, we'll shift it to here, and then keep on oscillating, it will definitely impact your prep months.
No,
So
no.
it's better to first of all fix the date and the day as well in the very first attempt itself, and then try to maximum not to change it. So things will go well.
Good evening,
Okay.
sir.
Thank you, sir.
Sir, what are the resources apart from the sir which has mentioned earlier you used? And also, sir, one more question is that could you please explain the difference between the GP and the RMO?
I think that part, man, Deepthi already told, I guess, what the difference between a
Don't worry about that
GP
part.
and
It's
RMO.
already
Yeah.
recording will be coming up. Don't delay asking same questions. Recording will be coming up, so you can get that recording. And please, we have a limited time. Ask serious questions only. And already answered questions, please don't come in because we already have the recording and we'll already share in the group. So that time you can check. Okay.
Hi, Dr. Faisal. Can I add small point in one of the
Yeah.
question, if that's okay?
Yeah. Sure, ma'am. Sure, ma'am.
Someone asked regarding therapeutic guidelines and REC GP. I think Dr. Aditya, am I right? He shared very good information. And welcome, Dr. Aditya, to Melbourne. We'll see you soon. I think even I live
Thank
in
you.
Melbourne.
Sure. Yeah.
So, one thing for every one of you is therapeutic guidelines is for the clinicians, doctors, general practitioners who work here in Australia. It's like a Bible, Bhagavad Gita, whatever you feel like it's everything's there. Is it exactly useful to the AMC? It can be, not in every aspect, but I don't suggest to take the subscriptions just because if you want to prepare. I think everything is not completely in total from ETG, and therapeutic guidelines is followed by everyone. Whatever there in therapeutic guidelines will be there in RECGP, will be there in RCH. There will be no contraindication. It's just the same copy and paste and different articles together. It's more for working doctors. So if you already have therapeutic guidelines access to you, that's really good. But my suggestion is it's a bit costly even for the ones who are working here. So unnecessarily do not waste your money because the same will be there in RCGP, RCH. It's just you need to find those articles. That's it. Thank you. Sorry for disturbing.
No
Ma'am, just
No,
to
problem.
no,
add
no.
on,
It's a great
ma'am,
thing.
so I already do have a scholarship of therapeutic guidelines. I already do have it. So should I just follow the therapeutic guidelines or should I also read RSEGP?
You have to combine all the
Accordingly,
information.
whatever you need to club everything for AMC preparation. Neither one is ideal or 100% for everything. You can
Yeah.
follow both depending on
Sorry to
what
interrupt,
topics you
ma'am.
are
Okay,
reading.
thank
For
you, ma'am.
her question, I'll put it in a better way. Since you said you have a subscription for therapeutic guidelines, and you can as well as you can use the RSCGP as well. But what I will tell you is there is a stuff in e-medicine. if you go solve a question, whether if it's wrong or right, as you scroll down, they'll give a explanation and they'll give a guideline and everything. Below that, for every single question, it varies. Below they themselves itself, they would have mentioned this guideline is from therapeutic and this guideline is from RACGP. So it's like you can you can have a just a look over of both the stuffs. It's not like you just have to follow this or that. We are in a field like where we have to see a lot of things. So it's better to look at both.
That's absolutely true what
Hello.
Dr. Aditya shared.
And a good news for
Hello.
people who don't have a therapeutic guideline, we might get a
Can
therapeutic guideline for free also. I have made how you can apply, asking a mail to them. Okay, I added this thing also to my guide. So don't worry, if you don't have therapeutic guidelines, you can ask them to give a free version. So sometimes they will give you.
Yes,
There
sir.
is
Bro,
I
a
applied for the free version and they gave it to me for 1 year. So I have it like that way.
it's nice. That's nice. If you have a direct access, that's good. But it's not mandatory. You should have a subscription because see, if you utilize the eMedicine app from top to the bottom, is the best you can because you get so every single time if you have to open therapeutic guideline and RSCGP, it's not like you click the all the things pop. It's like you have to search. You have to search specifically it's like again you are gonna invest a lot of time in searching things over there. But eMedicine is the best and the perfect source for the AMC one. So from my experience, I will say trust eMedicine, get the subscription, and then utilize it from top to bottom. That's more than sufficient.
Hello.
Sir, good evening, sir. I
Yeah.
have a question.
Yeah,
Sir,
Can I
if we are
talk?
scoring, sir, if we are
Uh,
scoring around 50% to 60% in e-medicine,
okay,
like how much we need to improve more? And like to
okay.
sit for an exam more, how much time I need?
That's
Yeah.
another tricky question, but okay, fine. I'll answer it. See, I'll tell you one thing. eMedicine, they started posting questions and they created the app, and it came into the market like it was on last year, I think in April. And at that time, I was having a meeting with a lot of doctors from all over the globe, like from most of them from Bangladesh and from some from Nepal and then some from Colombia and from all those things. So what we all felt is the questions that we are going to see in the screen through email is actually the tougher version, what you'll be seeing in the actual exam. So in my aspect, what I will suggest you is if you're going to keep 50% and above in all the mock exams of eMedicine, it's like you are in the right track. 50% and above, you're in the right track. It's not like it's a guarantee that only if I score 60%, I'll pass in the exam. Only if I touch 70%, I'll pass in the exam. No, it's not like that. E-Medicine is is a tool which will make you to walk on the right track. So if you score every single time when you take a mock, and if you're gonna score 50%, that's a good thing. You are in the right track. Maybe you can check out, the information sector where you can find which area you're weak. Because one more thing, what I would like to add up is AMC is very, very fond of, asking you questions related with emergency medicine. So whenever you guys face a question that's going to mention like this patient came to ED department or this is an emergency case or something like that, just put an extra time and an extra effort in reading the question and solving that very particular question very seriously, because we won't know if because most what from my research what I felt is every single emergency medicine question that we are going to solve in the exam carries a big mark, maybe like 4 marks or maybe like 6 marks, but mostly it falls under the big marks. So emergency medicine is a very important aspect to focus. And regarding this 50%, 60%, it's not like that. For your 50%, it's gonna give you a confidence that you are in the right track. So yeah.
okay.
Hello,
Thank you,
Dr.
doctor.
Aditya.
We'll invite other guests
Sure,
also.
sure.
Like we
Yeah.
have limited time. Like they will also share. And thank you so much, Dr. Aditya. And I'll inform people, like if you have more question, I'll include Aditya also to. He's also in the community, so you can ask the direct doubts in the group. He will reply whenever he is having time. And all of you should pray and wish him best. Like he's going to write his AMC too soon, so I
Thank
hope
you.
everybody will pray for him and wish him best. And thank you, doctor, for sharing all this stuff. I know you can share more things, but the time limitation is
No problem, no
very less.
problem. That's
And
okay. Yeah.
I'll tell you one more thing, guys. He's a very nice person, like Dr. Deepthi ma'am, and like earlier Dhruv talked. He's also very like very kind person. Whenever I asked him to join, come and join for our community and help others, he was very much ready, and he was the one who asked me to conduct a webinar. Because of him only, we have this much big webinar going on, because people were asking so many doubts.
Yo, bro, don't give me such kind of
No,
picture
no.
and all.
See,
It's your hard work. It's your
no,
hard work.
it's not like that. That see, people who are not expecting anything and coming to give back to the society back, na, that is something big. It's very hard to find, because we all know those who already passed the AMC in this group, like all these 6 people who talked today, they all know how difficult it was when there was nobody to guide us. Literally,
That's
when
true.
we started preparation, there was nobody to guide us, or there was nothing to guide us or check reference. We know how many people we messaged, how many things we talked with many people, so many funny questions we asked. We never got a proper guidance. That's why I created AMC Catalyst, and I'm combining everything, and which is very easy for especially FMGs also, because our way of thinking is little bit different than those who are studying IMG, but we have equally FMGs and IMGs in this group, and we are trying to help everyone. And as doctor said earlier, epic verification, that is one of the biggest headache before AMC one. So we are helping in that also, how to get done with a epic verification also. So we created that guide which you are seeing right now. So more information about all your doubts will be shared in that guide. You don't have to worry if you miss any questions. Okay, all the doubts, all the common asked questions is already explained in this. So please give a thank you to Dr. Aditya for his time, and we will
No
welcome Dr.
problem.
Pooja also. She also cleared AMC one. Thank you, Dr. Aditya. Like due to the
No
limited
mention,
time
bro.
only I'm doing this. I'm really sorry
No problem, no problem.
because
That's
you know the
okay.
situation, right?
No,
So
actually, I feel really happy that people asked a lot of sensible questions because when I started to prepare, I used to use a lot, a lot of stupid questions I used to
yeah,
have, but it's very happy to see people asking so much of sensible questions. That's great,
yeah.
actually.
The people of who are following this, na, they are very much enthusiastic and they know the pathway. They have more difficult doubts also right now. So
Yeah,
let's
yeah,
see,
that's
let's see.
true.
And I hope Dr. Pooja is here. Are you here, Pooja?
Yes, doctor.
Yeah, welcome, Dr. Pooja. She's also one of our member. She cleared her AMC one, and she's also ready to help. Can you please introduce yourself, ma'am?
Yeah, so hi, doctors. So thank you, Dr. Faisal, for inviting me, and also Dr. Deepthi. She also gave a lot of, she answered a lot of my questions too, like, after AMC 1. So my name is Pooja, and I did my degree from Georgia, TSMU, Tbilisi State Medical University. I'm also an FMG. And initially, I was planning to do in the US pathway, the USMLE pathway, but then I had a change of mind. I wanted to continue in the AMC pathway. So that's when I shifted and I gave my AMC one in October. So yeah, that's a little bit about myself. So what questions do you have?
Ma'am, as
Hello,
you are a
Dr.
FME
Pooja.
student already,
Yes.
I just wanted to ask you, like, would you suggest students who have graduated from Georgia should
Hmm.
give FMG or should start their preparation for AMC exams because their end goal is to go to
Hmm.
Australia? So, do you ask them to like go back to their country, do their internship, and then waste their 2 years? I wouldn't say waste, but like if you really want to go to Australia, even that's a long journey. So, how do you think student like this should go ahead with it?
It's a really good question. So I would advise you to clear the FMG if you have the option to do it. Because I know like many of my batchmates who didn't give the NEET UG, so they are not, able to give the exam. So if you can get a registration from if from your home country or the country that you're doing, I think that is a really good thing, because then the recency of practice, right? Like after AMC 1, when you're applying for jobs, they do look for recency of practice. Obviously, like you can cover up with observerships and all, but clinical recency in a clinical in a hospital itself, it's much valued. So if you can get that, I would suggest you to do it, but simultaneously try like preparing for AMC 1 also. I directly jumped to the AMC 1 because I didn't give my NEET UG. So I took this pathway directly, but still, even I'm trying to see if I could give the FMG, because I'm hearing like some of the my batchmates are able to do it. So I would suggest, if there is an option to do FMG, I would 100% support you in that, and simultaneously work for AMC 1.
So, like, you said that
Yeah. So
you might get
yeah.
a chance to give FMG exam if you might give it
Mm-hmm.
now, or
Yes.
maybe you have some time. But after that, you still have to do like 1 year of internship back in your country. So you first give your exams and then you do your internship, and then if you get a job, or like how do you
Right.
think both of that work? So after AMC 1, you continue doing your internship back in India and then prepare for AMC 2 like that. Like, that is what has to be done. Hello. Am I audible?
Sorry, doctor. Yeah, you were getting like interrupted. I don't know if it's my internet issue. Can you repeat the
Can
question
you?
again? I'm really sorry.
Yeah, I just wanted
Hello?
to ask, like,
Yes, I can hear you now.
so you first start with your preparation, like, you start with your FMG
I
preparation, you give
started.
your exams.
Yes. Uh, so
Yeah,
I
like,
didn't
I'm
start with
asking for
FMG
myself, like, you
because
want, I
yes,
get it,
doctor.
you
So
didn't, but like, I'm asking for me.
like
So
you
for
said,
me,
the FMG. Yeah, like you
yeah,
said, for the FMG, I didn't actually plan to do it, since I had the same thought process of how you're saying right now. I was like,
yeah,
anyways, I'm not planning to continue my practice there. So if I'm like
yeah,
planning to start my journey as a doctor in Australia, I don't want to miss 1 year. That was my concern too. But again, like in TSMU itself, like my university, I did a USMD program, so that was affiliated to like a university called Emory in US. So my journey, I started like that, so I never thought about FMG at all. But then when I
okay, makes
switched to AMC, yeah, when I switched to AMC, as now I understand, like I'm trying to again sit for clinical exams soon, and at the same time I'm applying for jobs. So what I understand, it's that so you have to make your CV very strong, and there are people who have no gaps in the, like once you're done from like let's say Georgia or any other countries, you will have, like if you are not doing an FMG exam, or if you're not having licensing, you're not able to clinically practice, right? So even though that is not a mandatory criteria for AMC, it is beneficial. I would say it is beneficial, because the other applicants who are applying do have a good recency of practice. So you have to make your case strong, saying that no, I'm clinically active. I'm an equally good candidate. So if you can get that path, like if you're doing an internship and you have cleared AMC 1, when you're applying for job, you are currently working. And maybe after that, if you're working as an RMO, and then you're applying for the post of RMO. So that makes your case stronger for them to take you for the job.
oh, okay.
Yeah.
I understand. And
Yes.
apart from all of these preparations, what
Mhm.
else can you do? Because as you're still working and doing your internship back in India, what
Mhm.
all can you do to like boost your CV? Because until you don't get your like your license, you cannot actually do anything back at your home country, right? So
Right.
what all can you actually do that stands out? Because apart from that, we won't might be selected in the
Yeah.
selection
So,
process.
like Dr. Deepthi said, you can be like, active in other stuffs, like, because you need CPD points too. So you can do the observerships in hospitals, so that even if it is not as clinically practicing, it still give you it's not a gap, it's not a proper gap. So you can do observerships, you can do research, you can do like this online. There are like online courses which give you like CPD points. You can actually do AMC clinical courses, which will give you CPD points also. Like for the AMC clinical, I personally have taken like Dr. Amir's course, really nice. So he, when you do certain modules from him, he will give you certificates for the CPD points. So these are also another ways to stay clinically active, like clinical knowledge wise. I'm not saying practically, but knowledge wise, it's active to prove that you don't have gaps in your knowledge. You're still
Okay.
strong in your content. So these are like good ways to do it.
Okay. Thank you so
Yeah.
much.
Hello, Dr. Pooja.
Yes, Dr. Rohit.
So actually, I had the question regarding the degree verification. So actually,
Mm.
the thing is that my MBBS degree has been verified by the Epic. They have actually sent the report to the AMC, but then it still
Okay.
shows even after 2 weeks that I'm not eligible to apply for the AMC examination. So I've tried to contact the AMC multiple times, but I don't know what is the next step to be taken because it's already 2 weeks and I'm anxious about what has to be done. I've paid money for everything. I've done the AMC portfolio, etc. So I just wanted to know what is the next step, next best possible step I can do.
So,
Uh,
doctor, from yeah, I
yeah,
think
sorry,
Dr.
sorry, Pooja.
Faisal can answer
Yeah,
it.
sorry, I'm
Yeah.
really sorry. Guys, we have one more speaker, and she experienced this issue. Okay,
Mm.
the next speaker already experienced your issue, so don't worry.
Okay.
She will explain that. Don't worry. That question,
Okay.
100% she will explain because when she was applying for the exam, she also faced this issue, but she got her eligibility back and she wrote the exam and she passed. So don't worry. This question, 100%, that will be the first question to her. Okay.
Okay. I'll wait then.
Yeah, yeah. And
Okay.
I'm not cutting off you, Dr. Pooja, but we are trying to close this thing
Yeah,
as
yeah,
soon as
no
possible.
problem, Dr. Faisal. I
Yeah,
think it
and
is more
guys, don't
better if
worry.
she could answer it. Yeah, because
Yeah,
I didn't face it more, so I'm not very
yeah,
strong
and
for that question. Yeah.
yes. Second thing is that guys, Dr. Pooja is also a member of our community, so you don't have to worry. She will also answer, and she is a very kind soul. That she, whenever I asked her any doubts, okay, she said, "I'm ready. I'll also help you." So you don't have to worry that all the people in this call who talk, na, they will help you at any time. Even if I am not there to coordinate or anything, these guys are very kind people. So I just called them. Then they said, "Okay, I'll be there." So like that, they are ready to give back. So you should be also like that, guys. In future, like if you pass AMC, also you should also come to the community and give back. I am hoping for that. And second thing is, thank you, Dr. Pooja, for all your valuable words. It's we both studied in same country. I'm also a graduate from
Yes, yes.
Georgia, and that is a
Yeah,
very
yeah.
important. And second thing is that when I just asked her, can you join our community and can you help? She said yes, and she is a very active member from that. And like our community is not so active, but whenever there is a help or doubt they want, people want in the community, she is also there to explain and to share everything. So I am really
Yeah.
so overwhelming. It's
Any
really
questions you
overwhelming
have,
for me.
I'm ready to like answer it in the group too. And I think I contacted Dr. Faisal soon after my AMC one was done. I think around the same time we both cleared. And I remember the when you don't have a proper guidance and when you don't have many people to answer your questions, how hard that journey can be. So I think the first person I reached out seeing is Dr. Faisal, because we kind of cleared in the same month or like close to it. So when Faisal was saying like this is a webinar where we are like answering the questions, I was very happy to do, because I want other people to get more insights and inputs where we didn't get it back then.
Yeah,
So that's something very nice Dr. Faisal is doing. So I'm very
yeah,
happy to do it.
yeah. Because only due to that thing only we started the community, because so many people don't
Exactly.
have any idea and what to do it. And don't worry, guys. We are giving out a guide. So I think I have sent all the people who are talking today the guide, and I think they reviewed it. Like they have checked the guide. Like it's for it. Everything is solely explained on that guide. So if you, I'm telling you again, if you missed any questions or any details about this webinar today, you don't have to worry. All your questions, I had already many questions getting before. So all the questions are answered in that. It's around 20 to 22 pages of uh, PDF. It'll be shared. Okay, and you don't have to worry. I typed it. I cross checked each and every point, and if there is something we needed for addition, we have added that, because Dr. Dhruv and Dr. All the doctors who already cleared, I have sent them, and they help me to make this guide. So it will be easy for you when to apply for epic verification and everything. So you don't have to worry. And again, thank you, Dr. Pooja, for the wonderful talk. And I'll invite Dr. Anne Maria. She was my study partner also. So I'll invite Dr. Anne Maria to give talk about it. And she also passed in same month with me. Are you there, Dr. Anne Maria?
Yes, I am there.
Okay, she will explain about the question Rohit asked, like Dr. Rohit asked about she's also experienced same issue, and recently other one of my member in the community also experienced same issue about this verification. So she will explain that.
Shall I ask the question again?
Yeah, you can ask.
Hi, Doctor. And so
Hi.
actually, I've actually given my degree for verification. So my Intel account actually tells me that the Epic verification request has been sent. The report has been sent on 16th of February. So it's almost been 2 weeks. And but still in my AMC portfolio, it says that I'm not yet eligible for applying the AMC Part 1. So I just wanted to know, I tried to contact the AMC multiple times. So there is a contact form in their site. So I've sent multiple times the contact form. Still,
They
I
are
have
not
not gotten.
responding. They are not responding to you.
Yeah, they're not responding. The only I only got a automatic mail saying that the email has been sent to a specific section which handles that issue. So
I think nowadays they are getting so many mails and such queries.
yeah.
Earlier days it was very less number of candidates are appearing, so that they are responding very quickly. But I think you have to wait for some more time. Then they will surely, they will 100% they will respond your mail. You have to wait some more time. That's the thing, because in my the case also they were showing the not eligible thing. I mailed them. The Faisal also gated at that time, and I mailed them. They responded within 1 week, and the thing happened. I think some miscommunication. This thing happened because we are already verifying our medical degree. There is no need to show the not eligible thing. Something I don't know what is they are doing, but some time will take to the epic verification. And the epic verification is, I think, the for every plab USMLE the step is same. And the AMC portfolio we are doing the separately for the Australia. So the epic people have to send the medical degree to the Australian side. So I think some delay will happen in that section. That because of that only they are showing the not eligibility.
I mean, they have already said that the Epic
No,
report has been
I'll
sent
tell
to them.
Dr. Rohit. I'll tell you. I'll explain you simple way, like what Dr. Anmeya said. Like there are only two reasons to reject your eligibility. One is that the documents which you send to Epic verification, they will have some issues, like your passport might not be correct when you upload again in AMC portfolio, like it won't be matching, like that, some clarity issues. So they will reply you to upload again your passport or your degree. Okay, means your passport, basically passport, not your degree. But second thing is when you send a AMC report, AMC portfolio report, means when you send an Epic report to AMC portfolio, the AMC portfolio have to process this report, and they have to cross verify everything. Not sending any mail to college or anything, but the message the Epic sent to AMC portfolio, they have to check that and cross verify. After that only they will put for eligibility. Okay, earlier, as Dr. Anmeja said, earlier times it was very fast. Like when I told her to apply for like that, she got reply within 1 week. Okay, but nowadays my other one of my member in the community asked same issue, had same issue. There are so many people with same issue right now, because there are so many applications, so they don't have enough source to verify very fast. That's why this is happening. And I'll tell you one more thing. AMC will reply you. Don't worry about that.
Yes, that is
AMC
100%
100%
sure
will
they
reply.
will reply. And in my case, I didn't did anything. Just did the mail, and eventually within 1 or 2 weeks, they automatically into be show us eligible. Not
Because
eligible, directly showed us eligible. I didn't did anything, and they automatically. In my opinion, some delay is happening in the Australian or portfolio system, and they will correct it automatically. We have to wait. That's the main thing.
Okay, thank you, Anne.
Uh, guys, we are trying to wrap up the session. Dr. Ame, thank you for your answer. Because
I got
the
Fadil. Sorry for interruption. I just want to quickly finish one last sentence.
yeah, sure.
Anything related to Australia will take a lot of time. That is an unfortunate thing everyone should be ready for. For any email, even if you're inside Australia and messaging APRA, emailing APRA or anything, it takes time and time. I just applied for change of supervisor name from one doctor to the other who works in the same place, same clinic, wife and husband, no other changes. So just for that simple change, APRA took 4 months to approve. So that's an unfortunate thing, but they will do it eventually. The only thing is the time and wait, which is very hard. But for whoever facing these delays, it's not only when you're outside Australia, it's when you're inside also. That is unfortunate. It's like 4 weeks minimum for anything for them to reply or do. But yes, as the other doctor said, you will get it. It's only a matter of time.
Thank you, madam.
Okay, guys, we are about to wrap up the session. And Dr. Deepthi ma'am is helping us so much, guys. I don't have any words to say, but we have to wrap up the session and thank all the speakers today for giving a wonderful speech and clearing many doubts. I hope everybody understood what they meant, and the recording of the session will be provided in the groups. I hope so, because if there is no any issues with the audio or anything, we will share this. And we are, as I told you before, we are going like two minutes. I'll talk about the guide and the notes we are going to launch. This is the guide we are going to give you guys. Okay, so it include everything which you need, like all the registration thing, all the money, all the things, all the timeline, everything is included in that, in this stuff. So you can read about this. And I'll invite all the doctors to say thank you, like for coming and talking. And first of all, I'll thank our chief guest, Dr. Deepthi ma'am. Ma'am, can you hear me?
Yes, Dr. Faisal, and you don't need to thank me so much. I'm very
Ma'am,
happy to help everyone as I can.
ma'am, we have to thank you because it's very hard to find a person who's already in Australia to give this much advice. So for us, this is a big thing. That's why I'm thanking you this much, because this is a big thing for us. And guys, don't worry, I'll share Dr. Deepthi ma'am's all the details, like Instagram thing, to the our groups. So you should follow her, and her tips are far better than mine, because she is already in Australia and she have more knowledge. I have a limited knowledge up to Australia, like up to AMC1 and AMC2, like all the steps, because I'm talking with many people. But you have a person who already there, so you will get little more insight into it. Try to watch her reels, and it's very nice also. Like, I am also getting so many information from her reels, and today also I got new information from her. So I'm very delightful to have you in this webinar, ma'am. Thank you so much for attending.
Always welcome, Dr. Faisal.
Okay, then Dr. Aditya, and he's also one of a very close person who readily accepted this invitation, and because of him only we are today done this webinar. And thank you so much, Dr. Aditya. Are you here?
Yeah, bro, I'm here. It's okay, for no issues. It's
Yes,
my honor to be here. So yeah, I'm really happy.
yeah, and he will be in our community also. So if you guys having doubt in about anything, he will also there to help you guys. Okay. Hello.
Yeah, can you hear me?
Yeah, I can hear. I can hear.
Yeah. So yeah,
So
that's the thing. So yeah, so all the best, guys, for AMC one, for the for the future candidates who are gonna appear for the AMC one. for now, as already Dr. Deepthi ma'am said, basically this Australian journey will take and it will consume, of course, definitely a good amount of time, but you can't come and again ask us like, tell us an estimate amount of time or something like that, because everyone's scenario is different from, for example, Dr. Faisal's situation is different from mine, and from our situation, Dr. Deepti ma'am's situation is different. So it varies. So yeah, so that's the thing.
Okay, okay. Thank you so much, Dr. Aditya, and all the best for your future thing, AMC2, and all the
Thank,
stuff, and safe journey.
thank you, thank
Guys,
you, thank you so
I'm
much.
telling you again, please include in your prayers that he should pass in his first attempt, and he will be a motivation for us. So I am hoping for him, hoping best for him, and rooting for him. Thank you, Aditya, uh,
Thank you so much for, yeah.
and Dr. Dhruv. Are you here or are you left? Because he is working and he was very busy. Uh, I don't know he's there or not. And I am thanking him also. And Dr. Pooja, uh, hello.
Yes, doctor.
Yeah, and thank you so much for joining the webinar. And she's also one of the recent, like, first people to join our community after clearing AMC1 and helping many people who are in our community. So I'm thanking you so much for attending this session. Okay. If you have,
Thank you so much for inviting me, Dr. Faisal. And I think good luck to all the candidates who are preparing for AMC1. And I think he's going to be here to, like, motivate and give you guidance more, since, he has this page and everything. I think keep their pages in your mind. If you have some doubts, reach out to them. And we are also there in the community. We are happy to help all of you. Yeah, and yeah, good luck.
Thank you,
thank you,
everyone.
sorry.
Thank you, everyone.
Yeah. Thank you so much, and thank you, Dr. Anne. Also, she'll also be in the community, and she will also help. Thank you so much, guys. Ma'am has shared her name, this thing in the chat, so you can check that up. Okay, and Insta page about ma'am's Insta page, and I will also share. Don't worry, I will share the page in my Instagram and all the WhatsApp groups and Telegram group we are in. So don't worry, I'll share her page. Okay, and it's very helpful for you guys. And thank you to all the doctors who came here today to attend the webinar. And see if you have any doubts, maybe direct messages in the Instagram. We might not be able to answer regularly, but whatever help you ask in the community, it will be answered within 24 hours. That we are guaranteed, because we are around 6 people to 10 doctors who already passed AMC in that group. So we will help you guys to reach out and clarify all your doubts. Try to join the community so that it's not a place to teach you, or like, it's not a coaching center, it's a guidance group. Okay, it is in a Telegram, so we will share the link of that also in the group. Don't worry about that stuff. See, those there is a small membership thing. It's lifelong, and we are planning to do this because to only have genuine people in this community. And those who join the community, they should, when they pass the exam, they should also help your juniors who is coming in following years to the community. And we made this to help each other. Okay, these communities basically, we know the struggle when we started our preparation for AMC1. So this community is basically to help you guys to reach out, how to prepare for AMC1, AMC2, or the GP pathway, PESCI pathway. Every pathway I talked with Dr. Deepthi ma'am, and she also cross-verified our guide, which is already showing in the screen. So most of the steps we have talked with many doctors and proofread it, and I hope it will be helpful for you guys. Stay tuned and follow our both page, my page, all the doctors page, and ma'am's page also. And thank you guys for attending this. Have a great day. If you have any doubts, you can message me in my Instagram, or you can join the community and directly ask in the community. Everything will be shared there. If anybody want to talk something, they can say right now. We will close within 3 minutes.
I just wanted to say thank you to all the doctors for taking out time, because there are a lot of people who have cleared the exam but are not ready to help, and there was a lot of confusion. So I would like to thank all of the doctors who helped us. Thank you so much.
Thank you, Tanvi. It's nice of you to say like this. Anything
I
else?
would like
Otherwise,
to
we
thank
can close
Dr.
it.
Faisal and all doctors.
About the notes, we will be sharing that soon in the community, and we will be launching. We are writing right now. Right now I'll share the notes how it will look like. And guys, if you like the webinar and it was helpful for you guys, please give a thumbs up in the group chat. Okay. Right now I'll share. Thank you so much, guys. I'll show you the note we are going to give. Can you see my screen? Guys, can you see my screen? Yeah.
Yes, sir.
Yes, yes, sir.
So this is no only we have finished neurology only. We have around 16 more books to come out. We will be launching a website with the name AMC Catalyst with notes, PYQs, questions from eMedicine and all the recalls combined. Like eMedicine have around more than 5,000 questions. We can't finish that much, but we will be taking most important and medium to hard level questions, easy, medium. We will combine all because some topics there are around 200 questions which we don't need. So we will be taking top 50 questions from that and we will be giving out like that. We are combining around a 2000 question Q bank also. Then we have recall sessions coming up. We don't charge much fees. We'll be having a very easy thing going out, like mostly focusing on FMG and IMGs because we don't have much uh, exposure to clinical area. That's why we are making a notes more related to that also. So this is a neurology note. I think you can see the things we have put pearls, like which is very important. You have to think and important topics like this in a like you have if you are an FMG, you know that we have that missed or erased notes, and we've tried to made it more like prep or narrow type note. Okay, we have highlighted most important things with red color, then second most important with yellow color, and most important with this purple color. I think you can see, and we have given step one, step two, step three like that also, and we have given PYQs from that related topic also. This was a PYQ from October 2025 related to headache, and we have included all the topics, more interesting type of this thing also. We have see tables also. This thing is a combined note from all the notes which are out there in the market, plus RACGP guideline, therapeutic guideline, okay, and RCH, all the type of guidelines combined because I cross verify and all the doctors in the community cross verify these notes. And I have sent these notes to many consultants, and to if there is any mistake, they will rectify that also. And we have tried to include everything. We don't skip any topics, we don't include unnecessary topics also. So we are about to finish, only two more topics are left to finish in this note. So we will be giving neurology note will be a demo, so it will be sent out for free. So you can understand and you can compare with any other notes. I am 100% sure that there is no any other notes which is more related to AMC like this because uh, some notes will be same copy from John Murtha. There will be any other no other difference. But this is a combination of all the important things and explained very well. And we will conduct some online classes also how to read this note. We are not going to teach you, but we will teach you how to read this note properly and how to understand the things, how to think also. And we will connect this note plus question plus guidelines so that it will be easy for you to understand. You're getting the point,
Yes.
right? Yeah, so this is what we are planning to do. It will take some time, maybe 1 or 2 months. I am also busy. I am writing this thing. It's very hard to write a note. So I already have my note. My note is see my note look like this. So it is very hard for you guys to understand. From this, I am making a note to not like this. So it is this is hand typed. Okay, everything is hand typed in this. That's the problem. So it is very difficult to make. Even the guide we made, na this guide. This is the guide. The guide we made. I'm telling you seriously, the guide which we made, na this is handwritten, like hand typed. So it took around me 10 hours to make this guide. So there are a lot of hard work behind this, and many of our doctors sit behind this to proofread. So we are giving out this for free because I am getting so many queries about the fees, all the stuff. Everything is explained. All the 12 chapter explain everything you need to know till you reach Australia. Got it? If you have extra doubts, you can contact me in Instagram, or you can directly join this thing. What? You can directly join to community. I recommend you to join the community so that we can answer you properly. So please try to join. I will share the link in the group. There is a small registration fee, but doesn't matter. That registration fee is not much for a person who is planning for AMC pathway. So it's up to you guys. I'm not forcing anyone. It will be best for you because individually replying to all the DMs in Instagram is not possible and not timely done. But we will try to answer that also and try to follow Dr. Deepthi ma'am's page also. So it will be helpful for you guys. And thank you so much for coming here. And okay, guys, bye bye. Let's wind up. No more doubts, I hope, and I hope everybody is happy with the webinar. We'll see you soon for our next webinar. Community members will have monthly once webinar for discussion and clearing your doubts. You don't have to worry. I will send this guide in the groups. Okay, you will get this guide for free. Usually everybody will charge money for the guide also, but we are sending out everything for free. And website, I told you this will be our website coming out, and this will be the cheapest website that will, or cheapest thing that you will ever get to study for AMC. So we are trying to make it most affordable. So it won't be expensive also, and it is there to help you with everything, and we won't charge anything. So try to attend and try to join these stuffs. Okay. Uh, any more doubts? Because it's nearly 6 o'clock, we can wind up. Okay, guys. Then thank you for attending.
So, one small doubt. Actually, like I heard from a friend of mine that we need to give an exam like OET or IELTS. So should we prepare for that before we give our AMC part one or after it?
After it.
Okay.
See, here in this thing, na, I have given full information in this our guide. See, MBBS, Epic Verification, AMC Portfolio, AMC Exam, and then English.
Okay. Okay. The OET is valid, right?
Sorry.